Good morning, everyone. Today we will discuss about the case study analysis of the accuracy of the polygraph test of a person with a high blood pressure. In this case study, an individual with high blood pressure or hypertension is undergoing a polygraph examination as part of a criminal investigation. The polygraph test is designed to assess whether the individual is telling the truth about their involvement in a crime. However, due to their medical condition, there are concerns about how hypertension may affect the polygraph results, making it difficult to accurately interpret physiological responses such as heart rate, blood pressure, respiration, and skin conductivity. In physiological factors, high blood pressure or hypertension is a key medical condition in this case. Hypertension can affect several physiological parameters that polygraphs measure, leading to compromised accuracy. These include heart rate, blood pressure, respiration rate, and skin conductivity or galvanic skin response. In heart rate, hypertension often leads to elevated heart rate, even at rest. During the polygraph test, this increased baseline heart rate could be misinterpreted as anxiety or deception, even if the individual is being truthful. Alternatively, some individuals with hypertension may show a diminished heart rate variability or difficulty increasing their heart rate under stress, potentially causing a lack of clear differentiation between deceptive and truthful responses. In blood pressure is a critical component of a polygraph measurements. Hypertension leads to a higher than normal baseline blood pressure, which may further increase during the test due to stress or anxiety. The examiner could misinterpret their elevated blood pressure as a sign of deception when in fact it is simply due to individual's medical condition. While in respiration rate, individuals with hypertension may experience irregular or shallow breathing, especially under stress. The polygraph measures respiration to detect physiological responses to stress or deception. A person with hypertension may have altered breathing patterns lead to misinterpretations of the data. While in skin conductivity or the galvanic skin response, high blood pressure can impact sweating patterns, potentially increasing skin conductivity. This could result in false positives or negative result in the polygraph's ability to detect the nervousness or anxiety, which are typically associated with deception.
Psychological factors. The psychological state of the individual plays a significant role in the polygraph test results. Stress, anxiety, and emotional responses to the situation can the polygraph readings. Key psychological factors include test anxiety. The individual with hypertension may experience heightened anxiety due to the nature of the polygraph test itself, causing a spike in psychological responses like heart rate and blood pressure. This could exacerbate the effects of their high blood pressure, leading to an inaccurate assessment of truthfulness. Fear of consequences. If the individual believes that the polygraph results may have severe consequences, example, criminal conviction or job loss. Fear consequences. If the individual believes that the polygraph results may have severe consequences, example, criminal conviction or job loss. This fear can increase anxiety and lead to physiological responses similar to those associated with deception. Stress response. The stress of being interrogated combined with the individual's hypertension could amplify their physical responses to stress. The polygraph examiner may incorrectly interpret these responses as indicative of deception rather than being linked to the individual's pre-existing medical condition. Cognitive load. The psychological strain of maintaining focus during a polygraph examination can contribute to heightened anxiety, making it difficult to differentiate between stress caused by deception and stress caused by the individual's medical condition.
Examiner competence. The examiner's ability to accurately interpret polygraph result is crucial to determining the test outcome. Competence in this context involves understanding both the technical aspects of the polygraph and the nuances of medical condition like hypertension can influence the results. Factors influencing examiner competence include experience and training. As experienced polygraph examiner will be a better understanding of how hypertension can influence sociological responses and how to adjust their interpretation accordingly. They will know how to differentiate between baseline stress responses due to medical conditions versus deceptive behavior. Next, knowledge of medical conditions. Competent examiners should be knowledgeable about medical conditions like hypertension and how they affect physiological responses. This allows them to take the individual's health history into account when interpreting polygraph data. Next, ability to adjust for baseline differences. A skilled examiner will adjust the polygraph test protocols to account for the individual's baseline physiological conditions. This could involve taking additional measurements of heart rate, blood pressure, and respiration before the test to establish a more accurate baseline for comparison. Next is subjectivity in interpretation. While a polygraph results can provide physiological data, they are also subject to subjective interpretation. A competent examiner must be aware of the potential of misinterpretation due to medical conditions and strive to be objective in assessing the results.
Impact of medical condition on polygraph results. In this scenario, the individual's hypertension can lead to physiological responses that may either exaggerated or mask the typical sign of deception. The examiner's ability to interpret these responses accurately will be crucial determining whether the individual is truthful or deceptive. However, without proper knowledge and understanding of hypertension's impact of physiological markers, the polygraph results may be misleading. For example, the examiner might mistakenly interpret an elevated heart rate or blood pressure as a sign of deception when an impact is due to individual's hypertension. Alternatively, if the individual's stress response is blunted due to hypertension or medication, the polygraphy may fail to detect the true deception.
Mitigation strategies to improve the accuracy of polygraph examination in individuals with hypertension. The following strategies should be considered. Number 1, medical screening. Conduct thorough medical assessment to identify individuals with hypertension before administering a polygraph test. This will provide variable context of interpreting the result. Number 2, baseline adjustments. Establish an accurate baseline of heart rate, blood pressure, and other psychological responses before beginning the polygraph. This may involve taking multiple baseline measurements to account for fluctuation due to hypertension. Number 3, psychological considerations. Recognize that the individual with hypertension may experience heightened anxiety with cold, distort polygraph result. Provide a calm and supportive environment to reduce unnecessary stress. And the last, examiner expertise. Ensure that the polygraph examiner is trained to recognize the impact of medical conditions such as hypertension on psychological responses and can adjust their interpretation methods accordingly.
In conclusion, the accuracy of a polygraph examination in an individual with high blood pressure can be compromised due to the physiological effects of hypertension. Elevated heart rate, blood pressure, and altered breathing patterns can lead to misinterpretations of the polygraph data, potentially causing inaccurate conclusions about the individual's truthfulness. The psychological state of the individual, including anxiety and stress, can further complicate the interpretation of results. To mitigate these challenges, polygraph examiners should possess competence in both the technical aspects of the polygraph and the influence of medical conditions on physiological responses. Proper baseline measurements, awareness of individuals' health history, and expertise in interpreting the data can help ensure more accurate results. That's all. Thank you.